Next, we have to talk about some respiratory movements. There is, upper ribs, which are helping us in pump handle movement. And if you are talking about the lower ribs, then they are helping us in bucket handle movement. Now, what is this bucket handle movement? See, respiratory movements, there are two types. One is called inspiration and the other is called expiration. So what about that? You have to understand that expiration is a passive process and it is due to elastic recoil of the lungs. Though you can use some muscles if you want forceful expiration, then muscles can be used. So telling that respiratory movement is inspiration, expiration, yes, and expiration is a passive movement due to elastic recoil of the lungs. But if you want to do forceful expiration, then you may use some muscles. Like which muscles? Anterior abdominal wall muscles. Like when? Like when you are doing coughing, or you are sneezing, or you are defecating, or you are urinating, or you are parturition also. Oh, giving birth to the baby. Yes, that time. What do? What is that? You have to contract the anterior abdominals. Why? To push the structures out. What structure? Whatever. Air out of the respiratory tube, or the fecal matter, urinary matter, or baby outside. Push it. So you mean to say we have to use the anterior abdominal wall muscles now? Yes, if you want forceful expiration, push the lung and air goes out. What about the inspiration? Inspiration, the chief muscle of inspiration is diaphragm. And how the diaphragm is helping in inspiration? Who is the other muscles of inspiration? See, diaphragm descend down during inspiration. So DDD, yes, diaphragm descend down during inspiration. And when the diaphragm descend down during inspiration, what will happen? Then the lungs will expand and they will suck the air inside, inspiration. So telling when I'm doing deep inspiration, diaphragm will descend down, yes. And the lungs will expand vertically, yes. And they will be sucking the air inside inspiration, yes, that's the point. Let us look at diagram. First of all, you have to tell that upper ribs are helping us in pump handle movement. What is pump handle movement? Sternum goes out in, increasing the anterior posterior diameter so that the lungs are expanding anterior posterior so that the air can move in, inspiration. This is for inspiratory movements. So you're telling that like a pump handle, sternum goes anterior posterior, yes. And when it goes anterior, what will happen? The AP diameter, anterior posterior diameter is increasing, lungs will expand and suck the air in. For inspiration, yes, okay. What about the lower ribs? What is this bucket handle movement? Lower ribs, there's a bucket handle movement, you see. Lower ribs will increase the transverse diameter of the thoracic cavity. So as the lower ribs move up, there will be increase in the transverse diameter of the thoracic cavity. What will happen? Lungs expand transversely. And when the lungs expand transversely, what will happen? Air will be sucked inside, inspiration. So this is for inspiration, that is for inspiration. Yes, of course. Here you are increasing the anterior posterior diameter of the thoracic cavity so that lungs can expand anterior posteriorly. And here you are increasing the transverse diameter so lungs can expand transversely. And what about the diaphragm? Diaphragm, I told you, when the diaphragm descend down in deep inspiration, then the lungs will expand. You see here. So this is the diaphragm you're talking about. Yes, diaphragm was here and now the diaphragm is there. So diaphragm is contracting now, descending down. Yes. So you mean to say lungs will have to expand vertically? Yes, vertically. Vertical diameter increases and air moves in. Which other muscles are helping? External intercostals. External intercostals. When you say it is the external intercostals helping for inspiration, what is the internal intercostal for? Internal intercostal is for expiration. It is for expiration. So external intercostal muscle between the ribs is for inspiration. Yes. And internal intercostal, which are deeper, they are for expiration. What about the interchondral portion of the internal intercostal? If you say interchondral portion of the internal intercostal, then they are inspiratory muscles. See the difference. First of all, external intercostals are for inspiration, and deeper them, the internal intercostal muscles are for expiration. But if you are talking about this area only, if you are in the interchondral region, there is interchondral region, costal cartilages are there. Interchondral portion of internal intercostal, interchondral portion of internal intercostal, though internal intercostal are expiratory muscle, but this is inspiratory. So you're telling that inspiration was done by two muscles. Yes. External intercostal and also internal intercostal. Yes. Though internal intercostal is majorly working for expiration, yes, but not the interchondral portion. Whatever is in the costal cartilage region, they are helping external intercostal for inspiration. Then who is doing expiration? Expiration is a passive movement done by elastic recoil of the lung, but you can use anterior abdominals like rectus abdominis, yes, and external oblique, yes. Transversus abdominis, yes. Transversus thoracis, yeah, transversus thoracis is actually in the thorax region and it can help you to compress the lung, compress the chest cavity. And what is this muscle which you were talking earlier about? Yeah, this is the internal intercostal. So internal intercostal muscles are expiratory except their interchondral portion. So internal intercostal muscles are for expiration except their interchondral portion, because interchondral portion are for inspiration. So these are expiratory muscles. Yeah, expiratory muscles, anterior abdominals. And there is one thorax muscle also which is given transversus thoracis. Transversus abdominis, transversus thoracis. Yes, it is on the anterior side. Anterior side. You compress them and you push the air out. Coughing, sneezing. Also, you know, what is called as the spasmodic contraction of the diaphragm. You know, what is that? Hiccups. Hiccups also. In hiccups also you have to contract the muscles of abdomen and chest, and then air goes out. Hiccups. Forceful expiration.